I'm going to call the meeting to order. This is Scott, and on our roll call, we've just gone over all commissioners are present and on the line, and I'd like to ask for a motion on the adoption of the agenda.
So move.
Is there
Second,
a second?
second,
All in favor?
aye.
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 So moved. And I'd ask for the June 8th special meeting on the item 3 on our agenda, adoption of the minutes from our June 8th meeting.
I so move the minutes from June.
Second.
All in favor?
Aye.
Aye.
So moved. Moving on to Mr. Rohr. Trent.
That is me. Good morning, commissioners and staff and public. I'll begin with my report. It's somewhat lengthy, but it's just an indication of how much is going on in our world. I'll start with the federal and then go from there down to state and local and talk about departmental operations, but also a lot what we're doing in response to COVID. So at the federal level, the big thing that we're watching now because of the impact on our clients or potential clients, certainly the unemployed, is the $600 weekly supplement for unemployment benefits, which was part of the stimulus law, is set to expire at the end of this month. So it's really a deadline for Congress to act on another round of economic relief before tens of millions of people will lose those $600 a week benefits. It looks like there is some movement, which is good. Of course, the implication for us is the potential not only for the loss of income of individuals who've lost their jobs and families, but the potential trigger for eligibility for some of our programs, depending on the circumstances of the household. So Senate Republicans, White House officials are discussing proposing a short-term extension of these benefits. Not clear it will be at the $600 level. That's part of what's being negotiated, I believe. And then in terms of a broader relief package, it looks like there is some movement. The biggest piece of that, I mean, we're looking at a lot of the pieces, obviously, but one we have a keen eye on is the relief to state and local governments. Obviously, San Francisco was hit terribly hard in terms of the budget impact of COVID. Looking at about a $1.6 billion deficit. The state similarly in the $40 to $60 billion range, and that's similar across cities and states across the country. So state and local relief is critical. If they can couch it in assisting locals for school openings or other things like that, I think that helps us. Let's see. That's about it for relief. One other piece I want to add is the continuation of the pandemic EBT. That's another important one for us, which is CalFresh benefits for school-age children, and hopefully that would be part of the package moving forward as well. So at the state level, it's all about money and the budget that passed. And fortunately for us, as an agency and somewhat for the city overall, there was a fair amount of relief provided. The biggest piece in the state budget that was restored is a funding stream that you've probably heard of through a presentation from Dan Kaplan called realignment. And realignment there's two buckets of realignment dollars. It's basically state tax revenue that flows directly to counties to support human services programs, public health programs, behavioral health, and also public safety. Because realignment, the source of realignment funds is tax revenue, so sales tax, vehicle license fee being the biggies, both of those decreasing significantly because of COVID, which meant that the revenue to support the human services programs was projected to decline significantly. The state legislature and governor did agree on a $1 billion general fund restoration of realignment. So this is out of the general fund and not from those tax revenue streams to backfill the losses of those revenue streams. They parsed it out into two segments. 750 million would go out right away, and then 250 million would be held pending a federal stimulus act that would provide some revenue relief for the state. Our share, and it's tricky because this doesn't, it basically flows into the city as a big pot, and the controller, and it's a formula based, and the controller determines how much goes towards what, and then we discuss it with the mayor's budget office as well. But the pots of money are not inconsequential. Of the 750 million that will go right away to counties, the San Francisco share for human services alone, remember it's human services, health, behavioral health, and public safety. For human services alone is 12.7 million. And then the $250 million, which is held until a federal package comes through, our share for human services of that 250 million is 4.2 million. So a total package of almost $17 million, or a little over $17 million to support human services programs. Primarily child welfare, but also in-home supportive services. There's some CalWORKs grants. It's kind of a mishmash, but it basically supports general fund support of our programs, which helps provide us with some relief, of course, given the city's budget shortfall. The other area, well, two other areas of one, a very significant state increase, and the other of not as big, but also helpful. One is in the area of CalWORKs. So the governor had projected almost a doubling of the CalWORKs caseload statewide due to COVID. And with that, an increase of funding for CalWORKs grants, but also for CalWORKs employment services. The legislature rolled that back a little bit in terms of the caseload projections, but maintained the support for CalWORKs employment services. Again, because of the projected caseload and the need for us to provide employment and other supportive services, childcare to families who are trying to get back into the workforce. So the increase statewide for the CalWORKs employment services piece is $600 million. Our share, we usually get 1.5% to 2% of the statewide single allocation. So again, a significant dollar amount to us. We haven't seen a final allocation number. We don't know exactly what that would be. I'll talk a little bit more about how we're projecting to use some of that money in a bit. In CalFresh, the state added a little over $80 million in general fund for CalFresh administration, which includes continuation of an emergency augmentation that we got current year, which was 24 million. And so that's going to be helpful as well. And that also draws federal revenue to support us. And I'll talk about the use of that locally in a little bit as well. Another couple items, few items that came through. One is the governor had proposed in his May revise to eliminate subsidized employment funding, which for us would be a huge loss because we have a very large subsidized employment program, one of the largest in the state, certainly the largest per capita when you look at our CalWORKs caseload. The legislature restored that. So we will get our full subsidized employment funding from the state, which is significant because we have a pretty large proposal into the mayor to expand subsidized employment to get more people into work. But I'll touch on that in a little bit. Also in a policy change, the legislature eliminated the 24-month welfare to work clock for CalWORKs and also increased the time on aid, lifetime time on aid to 60 months from 48 months. And with access to barrier removal services for welfare to work for the entire 60 months. So that's a recognition, of course, more difficult to get back into the workforce, more difficult to move off of public assistance. And so that extra 12 months will be certainly helpful for our families. And then the last piece I'll touch on is the restoration. Again, in May, the governor proposed to eliminate the Family Urgent Response System, or FERS, which is within our child welfare, family and children's services world, allows us and mental health to respond to crises in care to prevent kids from either from coming back into care after being reunified or from a placement disruption with a foster care provider. So that money was restored, and the language was restored to implement beginning January of 2021. So that's good news as well. As you know, we're one of the leaders across the state in doing an early mobile response system. So we'll be well poised when this program statewide begins in January of 21. So now I'll move on to COVID, and there's a lot going on, of course, with COVID. Let me give you just sort of a general, I think this might be helpful for context, kind of a general overview on what's going on in the city with COVID, not necessarily human services, but sort of overall, and why the work we're doing in the human services branch is so critical. So as of yesterday, there were about 5,500 COVID cases, 53 deaths, and about 222,000 test results that were reported. So that's about 27% of San Francisco's population. Last Friday, I'm sure you saw this, that San Francisco was put on the state's watch list for the first time. And that has implications for us being allowed to reopen certain things. For San Francisco, because the mayor had already delayed reopening of things like restaurants and things like that, because we were already delayed, it didn't really impact us, but it does say that there's another hurdle we now need to get through as a city to begin a reopening because we're on the state watch list. And that's of course triggered by certain data points showing an increase in COVID and an increased risk for surge in San Francisco. So mentioning surge, we did such a good job as a city in flattening the curve early on that I think, candidly, I think people let their guard down and thought we're over this. We passed the surge in New York ended, the surge in Europe ended. I think, we're okay. Well, what happened was I think, people let their guard down and people weren't wearing masks. People were getting together. We had the protests and demonstrations. We had Memorial Day barbecues. We had July 4th. And all that, I think, resulted in what we're in now, which is a surge. We are in a surge as a city. And it doesn't get talked about. People don't recognize it, but we are indeed have a curve of positivity that looks like this. In terms of numbers or stats, basically positivity rates and hospitalizations have more than tripled in San Francisco since early June. Again, a result of what I had talked about, and the mayor and public health director, public health officer paused reopenings indefinitely as a result. Let me touch on just a few of the goals we're trying to meet to get out of, or to begin to sort of reopen and get to a less steep curve or even a flattening. So the goal for COVID-19 hospitalization rate, we want it to be less than 10%. We're currently at 34% for the weekly increase, 34% weekly increase in hospitalizations. So we're considered a level 4 or a high alert on that. In terms of our acute beds available, we want it to be at 15% availability. We're currently at 23%, which is good. We're meeting the target. And then a 7-day average percentage of ICU beds available to maintain at least 20%. And currently, San Francisco is at 27% of ICU beds available. So we're meeting the target. And I mentioned those last two because that's directly related to the work that the Human Services Branch is to do, which is to open, oversee, and operate in some cases sites to basically help the medical system, hospital system manage the surge, to make sure the beds are available for people that really need them, and provide alternatives such as our isolation quarantine hotel rooms, alternatives to hospitalization. So those numbers that I just reported are somewhat in part to what we're doing at Human Services Branch. I mentioned the watch list. The state did announce that schools cannot open in person unless a county is off the watch list for at least 14 days. So San Francisco Unified School District obviously cannot open in person, and they're doing distance learning until the end of the calendar year. And then looking towards a hybrid in-person distance learning, maybe prioritizing vulnerable populations moving forward. And then a non-COVID related data point, well, of course, COVID related, a non-health data point that I want to mention is the unemployment rate in San Francisco in June was 12.5%. There were about 180,000 unemployment benefit claims that were open and active which is 10 times the amount that there was at this time last year. And then for comparison, in the Great Recession in 2008, 2009, I think the peak was something like 44,000 unemployment claims. So we are more than 4 times, or about 4 times that, which just shows you the extent of the economic devastation that COVID caused in San Francisco and across the state and the country. So what are we doing as an agency? I've talked a lot about our role. The COVID command, the Emergency Operations Centers has been renamed the COVID Command Center, or CCC. I had mentioned that we're now under a unified command structure starting July 6th, which means that HSA, Department of Public Health, Department of Emergency Management, and the Department of Homelessness and Supportive Housing are basically the 4 agencies overseeing the citywide activation and responsible for that. The Unified Command has 3 representatives, one from HSA, which is Dariush Kayhan, some of you may know. DEM is Adrian Bukele, and then DPH has a representative, Ayana Bennett, as well. And then they report up to the Unified Command, which is myself, Mary Ellen Carroll, the Director of DEM, Director of Public Health, Grant Colfax, and then Abigail Stewart-Kahn, who's the Director of Homelessness and Supportive Housing. So basically the body overseeing the citywide activation. It does mean that Noel Simmons and Dan Kaplan got to return to HSA for their day jobs after spending 3+, maybe 4 months at the EOC, and they led the propping up of our response, which was a huge undertaking, the 2nd largest response in the state, over 2,500 hotel rooms, several congregate sites for COVID. And I do see Noel, and Dan's on as well. And I just want to, in front of you, recognize them for their tremendous work, basically taking on a massive operation, overseeing a human services branch of over 100 people, a massive deployment, and also doing their regular jobs as well. And so just want to thank them. And I want you commissioners to understand what an amazing job they did, working probably 14-hour days, 7 days a week, without a vacation, without days off. So thank you to Noel and Dan, and you have a lot to be proud of. The system you built is fantastic and very, very effective. And so what does that system look like? More than 20 hotels with 2,527 hotel rooms. I mentioned for isolation and quarantine, but also in the largest piece of over 2,400 rooms for homeless individuals who are vulnerable, who we want to shelter in place to protect them from getting the virus. We are flexing up to about 2,600 rooms by the end of this. And right now we're at about 25, a little over 2,500, I think 2,527 I said. And I think we only have about 25 vacancies as of today. Right now, so once we flex up to 2,600 rooms, we're going to stop our hotel, the acquisition piece of the hotel rooms. We're going to stop at 2,600. It's what we're budgeted for. But the focus now for the Human Services branch is on managing the surge and propping up COVID positive surge sites. And what does that mean? That is basically, it's a congregate site, similar to a congregate site that we might open up in the winter during El Nino that we used to be responsible for, similar to what the Interfaith Shelter does, where you prop up a shelter site at a church for a couple, 2-3 weeks. That's what we would do for a surge. So we would open up a congregate site, provide a relief valve from the hospital for COVID positive homeless individuals and other individuals who can't quarantine at home. And that would be staffed with support from public health and disaster service workers and potentially some nonprofits. So the branch is focusing on identifying sites, assessing them, equipping them, and being ready really at a 24 to 48 hour notice from Department of Public Health that they need X number of beds to create hospital exits and hospital diversion so the healthcare system can take care of those who are sick with COVID and need hospitalization and support from hospitals. So that's what we're focused on now. We are looking at getting about 1,100 slots in congregate sites. They wouldn't necessarily all open at once, but the projections. the projections from health in a large surge is that they might need as many as over 1,000 or more beds to avoid possible impaction. And then I'll just mention because this was announced in the press, the homeless recovery plan, which is really, we will at the end of this have housed 2,600 homeless people in hotels. And we as a city and the mayor have made a commitment that we do not want to return any of those 2,600 to the streets. And so we want to exit them to any sort of permanent or perhaps temporary exits from hotels. So permanent supportive housing, perhaps rental subsidies, homeward bound. It could be other shelters as well, but we do not want to have to exit people to the street when we have to close hotels. So the mayor announced her homeless recovery plan, which is basically looking at using coordinated entry to identify housing referral status people who are in hotels to begin to move them into the system of care at the Department of Homelessness and Supportive Housing. So that's a lot of supportive housing sites. There's probably between 400 and 500 vacancies right now in supportive housing. So we can begin to sort of exit individuals out of hotels and hopefully close them and save some money, which I'll touch on in a sec. The city also plans to purchase at least 1,000 new permanent supportive housing units and add an additional 500 permanent supportive housing units in fiscal year 21-22 to really build capacity for this. And since I mentioned the hotels, the costs of these hotels are, as you might imagine, very, very significant. We're running now about little under $500,000 a day to support 2,600 hotel rooms. And that's not just the room rent, that's food, that's security, that's staffing, that's laundry, anything it takes to run a hotel and support people in place, that goes into that cost. So between $3 million and $3.5 million for every 7 days. It is important though that you understand that FEMA can reimburse up to 75% of these costs, depending on the population that's in the hotels. And we have funding from the state through Project Roomkey, which is the governor's hotel initiative, and then funding from the Federal CARES Act to help support some of that, the non-FEMA costs. And so the general fund is not bearing the bulk of these costs. In fact, they're bearing a small portion, but nonetheless, 25% of $500,000 a day is not a small number. And that is, the cost of those hotels are built into the mayor's budget proposal to the board that will go August 1st. So let me shift gear. Well, let me pause because I've given you a lot of information and open it up to just questions about COVID or about the budget before I move into the feeding support, food support, and then other operations for the agency. So commissioners, if you have any questions about COVID or the hotels or the budget, I'm happy to answer those now before Commissioner Semmel.
Yeah, it's not really a question, but more of a comment. I'm very impressed, Trent, with the response of the agency. And the thing that also impresses me is that you seem to be working in conjunction with the health department, with other departments. I think that's terribly important because wonderful as this agency is, you can't do it alone, nor should you do it alone. So I just wanted to say I'm pleased about that and thank you for what you do.
Appreciate that, Commissioner. One of the, I see someone else, is that George? Commissioner Yamasaki? Nope.
Well, I echo what Commissioner Semmel just said. You're doing a wonderful job, and it's a difficult situation, but you're certainly making the best of it, I believe.
Appreciate that, Commissioner. One of the positive byproducts, I think, of this is we've developed relationships with Department of Public Health, certainly Emergency Management, and Department of Homelessness and Supportive Housing at many, many levels of each of our organizations, from the top, of course, but at the deputy level and program manager level and staff level. that I think will really serve us well moving forward. You know we serve so many households and individuals and families in common that I think moving forward, once we're out of COVID, I think we're going to be much better as a city in our abilities to work together. You know, once you work together with someone for months, you know, it just makes it easier to do new initiatives and to troubleshoot and problem solve moving forward. So, Commissioner, to your point, I think that's really going to be helpful for the city.
Well, I'm glad to hear that, because it's been my long time feeling that nobody does anything alone, that it's so much better when we do it together, and I'm so glad to feel that way.
Okay, if there are no more questions, I'll move on to more of what we're doing. The Human Services Agency is also significantly involved in the food support under COVID. Shereen McSpadden, the director of the Department of Disability and Aging Services, really led the effort. And much of the food support for COVID will be in the HSA budget under the Department of Aging and the Department of Disability and Aging Services. Let me just touch on what we're doing with food, because it's you know, and if too bad Shereen's not on the call, but quite impressive what they have been able to do. So the San Francisco Marin Food Bank is reaching about 48,000 San Francisco households each week through their pop-up food pantries. And the food pantries provide bags of groceries, food boxes, and pantry at home distribution of home delivered groceries to older adults and people with disabilities. The school district's providing free meals to all children and youth in response to the school closures, primarily through school-based distribution sites and CBO partnerships. There's other pop-up food pantries and food distribution efforts in the Mission, in Bayview, Hunters Point, southeast part of the city, Excelsior, OMI, Viz Valley, and other low-income neighborhoods. We've been leveraging the Give to SF initiative, the private fundraising arm of COVID, which has provided us with millions and millions of dollars to support food. And then another initiative I want to mention is the governor's Great Plates initiative, which is a temporary meal delivery program for older adults who don't have access to food and who need to stay at home. The cutoff for that is 400% of federal poverty. The program has delivered over 266,000 free meals to almost 2,400 seniors who are sheltering in place and don't have access to food. This was a governor's program that's operating statewide. It's largely underwritten by FEMA, but it was really a neat way to not only provide support for seniors and folks who need the food, but provide funding for local restaurants. The Great Plates program the food is provided by local restaurants, delivered through a different party, but it allows a lot of our local businesses to stay afloat and to keep people employed. And so I'm pleased that we've been able to provide support for 2,400 seniors, but also for restaurants and for our employees who are working in those restaurants. On the communications side, as you might imagine, communications is key under a crisis response, but particularly under COVID when everyone's, people are staying at home and aren't out and about as much, shouldn't be at least. HSA Communications, we're in the midst of launching a social media campaign to encourage unemployed San Franciscans, immigrants who are in mixed status households, and older adults to apply for CalFresh food benefits. We're going to have advertisements on social media leading individuals to our website to apply, and the benefits, other benefits that they may be able to access through HSA, such as Jobs Now. And so speaking of Jobs Now, we're working with our communication staff and WDD, our Workforce Development Division, on a communication plans to really to revive and expand, we hope, our Jobs Now subsidized employment program. We'll be offering virtual and socially distant services and providing support to local businesses through Jobs Now. I mentioned the unemployment filings in the city, which are unprecedented. And so in response, what we have, and I touched on the funding support from the state, we are and have proposed to the mayor in the budget to triple the number of public subsidized employment opportunities at private sector employees, adding new wage subsidies to allow new businesses to enter into Jobs Now, again, helping to support our local businesses, some additional wage subsidies to support higher paying jobs. We're really trying to get over 1,000 people employed through an expansion of Jobs Now. We've seen our public assistance caseloads increase because of the need. We know the need is out there. This is very similar to the approach we took in 2008, 2009, when the federal government, through President Obama's Recovery Act, supported expanding subsidized employment at the local level. We employed in 2008 to 2010 over 5,000 people. You remember there was significant unemployment then. We don't have the federal support like we did last year unless it comes through in a new stimulus package, but we do have state supports to be able to expand Jobs Now in the same way. And what we found back then, and we're hoping to find now, is that businesses were able to reopen when they otherwise couldn't, because we would support a lot of their wage costs. We supported a lot of their HR needs, and of course, got a lot of people back into the workforce that otherwise wouldn't have been able to. And so that's in our budget proposal to the mayor. Hopefully it's the budget proposal to the board, and it'll move forward to be able to activate that piece of our agency. And of course, with that, bringing folks in who might be eligible for our other benefits, Medi-Cal, CalFresh, and cash assistance support. So speaking of the budget, the mayor, again, I said we'll be submitting our budget August 1st to the board. I talked about our growth in our CalWorks allocations and the of course, Jobs Now. Bigger picture budget-wise, we've hit our targets that were initially provided to us. One of the assumptions in the mayor's budget moving forward is that our public employee unions and our employees, all of us, would agree to forego the cost of living adjustments that we are due to get, the salary increases that we're due to get over the next 2 fiscal years. It totals about a little over 7% in 3 phases. They've already been delayed, but the mayor is hopeful that there will be some concessions to save the city well over $220 million. Now that's built into the budget. So far, the unions have not agreed to do this. And so the mayor's office has directed departments to come up with additional contingency reductions to account for a potential $200 to $220 million of lost savings. So basically an increased cost to the budget. Our number for the budget year is $4 million. Our number for the budget year +1, remember we're in a 2-year budget cycle, is $16 million, 1/6. Obviously that's a number that we are not going to be able to manage through revenue and through sort of small cuts here and there. The $4 million, again, these are contingencies, but the $4 million, we're looking at a combination of salary savings, so basically holding positions vacant for longer, and then looking at some other reductions elsewhere. The $16 million, we're still working on a path forward to $16 million. Fortunately, the $16 million would be in year 2, so we have a little longer runway to adjust and account for changes in revenue. But it's a big citywide. Obviously, it's a really big number, and it's an assumption in the mayor's budget. And so, if that doesn't come through, we're going to have to move pretty quickly to make additional reductions. In terms of our operations, the mayor's directive to departments was to maximize telecommuting wherever possible. Before COVID, we had about 2,200 HSA employees coming to the office daily. Now we have about 325 coming in every day. And so, telecommuting, about 83% of our employees, about 85%, is a Herculean undertaking, supported by HR, supported by IT, and others. Having that many employees working remotely. Mainly the people of the 325, mostly in our employment or our economic support self-sufficiency service centers, about 150 employees, FCS about 45, and then a smattering of others in facilities and IT and others. We are watching the programmatic dashboards that we have to make sure that there is not a degradation in services, both on the benefit side, also on the family and children's side. And we are seeing that we are keeping up. with things like our casework needed to do in family and children's, our emergency response visits or responses, our benefit processing timeframes. We are keeping up, and so that's really great work by sort of the backbone support on the admin side, but also by our management in family and children's and economic support, and of course the supervisors and the staff who are doing the work remotely, which can be challenging. And so speaking of our economic support self-sufficiency, the Medi-Cal program has been operating with increased flexibility during the pandemic. All of the annual renewals for Medi-Cal have been suspended until the federal government declares the emergency over, and no discontinuances or negative actions can be taken on Medi-Cal cases until October 25th, and that deadline will likely be extended. So the maintenance of a Medi-Cal support, healthcare support for households is obviously critical during this time, and the feds have allowed us to maintain that eligibility for individuals and for households. CalFresh had suspended renewals. However, that was lifted in this month. And so we now have an additional workload of doing our annual renewals. And the workload is going to go up significantly. It'll not quite triple, but probably go up 2.5 times. And so all the renewals that we didn't do in the past now have to be caught up, and we need to do them added from September on to November. And so that's going to be a significant workload for our CalFresh staff. Good news on the CalFresh side, though, the ABOD work rules, these are the work rules that require individuals aged 18 to 49 who are employable to work in order to get their benefits. That has been suspended until June 2021, so no one will lose their benefits in CalFresh. That increased workload, I touched on the CalFresh, the increase in the state budget, that is going to support the workload for all those renewals, but also for the significant increase in applications we've seen. We will largely do that through overtime and not through hiring of additional staff. It just takes too long to onboard and train individuals to get them online, and the need is now. So we'll largely be using that additional state funding to support overtime for our staff. In our CalWorks program, we've also seen an increase in submissions of CalWorks applications. The caseload increase projection is about 25%. And I already touched on the increased work that we'll be doing to support the Jobs Now expansion. Shifting gears a bit to County Adult Assistance Program, I want to just bring your attention to something we've been tracking, which is directly related to COVID, and that is our Care Not Cash implementation. As part of Care Not Cash, well, Care Not Cash basically for homeless individuals on CAP, they receive shelter, a shelter bed, food, and other support in lieu of a cash grant. Because all of the shelters stopped accepting new admissions and have slowly been decreasing their capacity, we no longer have that benefit to provide to homeless CAP applicants and current recipients. And so instead of providing a shelter bed, we are providing the full cash grant. We now are providing the full cash grant to 486 homeless clients, and the current homeless population on CAP is 996. Prior to COVID, we were running at about a homeless population of about 400 on CAP, so you've seen a significant increase. I bring this to your attention because it does affect our budget, of course, because we're now providing individuals with the full cash grant, and also the caseload reduction is less because we're now at 996. If they are in a shelter-in-place hotel or in a shelter, they will get a reduced grant because they're getting housing and 3 meals a day. But I imagine that this number will continue to tick up and will present a significant challenge for us post-COVID to basically reintegrate CAP with our shelter system in 2021-22, hopefully. So we will continue to watch that. And I do, as an aside, have a concern. One of the underlying policy reasons for Care Not Cash back in 2003, 2004, when we did that, was that many of our CAP individuals who are homeless were struggling with addiction and struggling with mental illness. And the provision of cash grants to individuals who are in those depths of disease sometimes led to very bad outcomes for them. And we are going to begin to look at, to the extent we can, things like overdoses, EMS responses that coincide with the distribution of or loading our EBT cards. I'm concerned that we're giving people who have significant diseases, addiction, and mental illness, and when we give them cash, bad things can happen to some of them. And that was one of the drivers of Care Not Cash. We have seen overdose deaths increase in the Tenderloin. We have had a number of them in our hotels. A lot of that's due to fentanyl that's mixed in now, of course, with heroin, but some of that has to do with the more cash on the street for individuals. So I am concerned about that. I do have a manager hire that I want to announce. Dr. Ramandeep Kalar. No, I said that wrong. Kular. Dr. Ramandeep Kular is the new CAP Health Services Manager as of July 1st. And Dr. Kular will be overseeing our DICU unit, our SSI advocacy, and our triage for our individuals in CAP who need support. Raman has been with Health Services since 2015, and most recently has been the acting psychologist supervisor for DICU. So congratulations and welcome if you are on the call. Almost done. So Family and Children's Services. We have had some COVID positive among our non-minor dependents. We had 3 tested positive. They are all doing okay, which is great news. We continue, of course, to track that. We held a virtual meeting with our resource family foster care caregivers on July 14th. We had 45 caregivers attend, which was great. The feedback was very positive from them. They really enjoyed participating on Zoom and seeing one another online. We'll continue to hold those virtual meetings with foster parents, and hopefully the word gets out and more will attend in the future. Also, due to the pandemic, the annual Resource Family Appreciation event, we had to cancel it. And in lieu of that event, we'll be giving all of our caregivers who had a placement during the fiscal year a $50 Target gift card and then a care package with PPE equipment, mask, gloves, first aid, and that sort of thing. It's too bad we had to cancel that event. So it was very well attended and a great event. And then we are excited to announce a new grant of $147,000 to support a pilot housing navigator program to help our young adults aged 18 to 21 who are dependents to secure and maintain housing, and really focusing on adults who are exiting the foster care system. And then lastly, and I know she's on the call because I had a chance to talk to her already, I want to announce the retirement of a long time HSA employee and Family and Children's Services Program Manager, Christiane Medina. Congratulations, Christiane. She has been with the agency for 30 years in a variety of capacities, beginning as a social worker in GAIN program, the old employment program under then AFDC in 1990. A few months later, she was reassigned to the homeless program, working with families who were in need of temporary and permanent housing under Dorothy Ennisman. And then her career with Family and Children's began in 1994, where she served as a protective service worker in the Spanish-speaking unit, and then as a 2917 program support analyst, and then the position she is retiring from, which is her program manager position. She's her work has been steadfast. Her experience has been invaluable to the work in the area of quality assurance, personnel and special projects. Really, I say behind the scenes, but that kind of does short shrift of what she does. But the work that Christiane does in that unit really makes sure that not only that we're supported with staff to do the work, but that the work that they're doing is quality and that is supporting kids and families the best that we can do. And in 2007, she was actually asked to lead the planning and implementation of 3 new units within Family and Children's Services. So this is the data unit, continuous quality improvement, and the policy teams to be able to respond to new federal and state requirements, and there are always many that come each year, and really support staff in implementing new policies, things like CCR, and ensuring that casework is of the highest quality. Some of her accomplishments include the development of 144 desk guides and policy manuals, 157 policy updates, and 155 service information alerts, and then the review of over 500 internal child welfare cases. All of that work is so critical. The world of child welfare changes. The federal law changes, the state law changes, regulatory changes, pressure from advocates, best practice changes. The use of data has expanded so significantly over the last decade. And Christiane has really overseen all that. And I can't thank her enough for her work. I was saying earlier, I had the pleasure of working with Christiane on the 8th floor from 1996 until she moved to her current office in just a couple years ago. I remember when her twins were born. I asked her before this meeting how old they were. They're 21 years old now. So it's been a journey. Christiane will miss, well, I haven't seen you around the office, but we'll miss seeing you when we get back. Well-deserved retirement. Very happy that you served for us for 30 years, and hope you have a great retirement and enjoy the relaxation and life post work.
Thanks, Trent. It's been my honor to work with families and children and all the people who really care about families in San Francisco, and just to see how the program has grown. And you know, it's been a journey. And I appreciate the support of you know, my coworkers and you know, my staff that is amazing, and my buddy Robin Love, who's done a lot of work also for the youth. And you know, I just don't know what to say other than thank you. And yes, I am. As soon as I can travel, I'm out of here. So just thank you, John. Thank you, just friends and the amazing people that I have worked with. I have to tell you, the last 5 years have been amazing. I have really worked with the best staff, and I wish family and children the best. It's not like I'm disappearing, but I will be, you know, out of here. So thank you.
Thank you, Christiane.
You know, it amazes me to hear these stories, and I'm so glad that you shared them with us, Trent and Christiane. Thank you so much for all your work. We don't hear enough of it.
Thank you, Commissioner. Thanks.
Christiane, thank you very much for appearing today and for letting us have the opportunity to thank you.
Oh,
We're going to miss that smile around the building, that's for sure.
well, thank you, Commissioner. I'm glad you guys are there. Thank you.
Thanks, Christiane.
Okay, moving on to.
I didn't ask if there are any questions, but before we move on from commissioners. But
Are there any questions of Trent?
sorry.
I think you pretty much covered everything.
Yeah, it was. Sorry for the lengthy report, but there obviously is a lot going on.
It's
Okay,
very
thank you.
important, very important report. Thank you.
Item 5 on our calendar is the presentation of our July 2020 Employee of the Month, who is Patrick Kramer. The Commission is pleased to announce that Patrick Kramer, a management assistant with the Family and Children's Services, is the July Employee of the Month. Patrick has provided management assistance for Family and Children's Services since he started at our agency 2.5 years ago, handling a number of duties and responsibilities with composure and goodwill. Patrick dives eagerly into his assignments and anticipates what would be helpful and useful for the task at hand, readily translating procedural knowledge from one project to another. His willingness to help and his loyalty to the division are exceptional. Patrick readily makes himself available, providing a useful, proactive approach to his work, always ready to step in and help with tasks ranging from spreadsheets to catering orders to meeting support and constant scheduling demands of the department. He identifies solutions to the multiple issues that crop up in child welfare and has provided coverage for multiple staff juggling countless assignments for a number of people without complaining. He has a unique communication background which helps hosting his own radio show during college along with a creative spirit. Patrick works well with many different people, is generous with his time and abilities, and is committed to the Family and Children's Services and its mission. He is a valued and respected member of our team. Congratulations to you, Patrick.
Thank you.
Trent, do you have any comments?
Unmute myself. Hi, Patrick.
Hi.
Congratulations.
Thank you.
I wish we could do this in person so we could get the Family and Children's crew in the audience to yell and cheer like they always do. Just want to say, I think somewhere in Commissioner Khan's remarks, you just said, sort of, you do whatever it takes, right? I think you mentioned catering among all the other stuff that you do to support Joan and support the division. And I know how much work you do because I get the emails from you that responding to certain questions that I have or the staff have. And I just want to say thank you for being so flexible in your work, for supporting the division, but also supporting others on the 8th floor. I appreciate it, and this is so well deserved. And look forward to shaking your hand when I can in about 2 years and saying congratulations.
Thank you. Thank you for having me here.
Thank you, Patrick. Moving on to item 6 on the agenda is our consent calendar. Do any commissioners want to remove an item for individual discussion? If not, then I ask for a motion to approve our consent calendar.
So moved.
Second.
All in favor?
Aye.
So moved. Thank you.
Aye.
Moving on to item 7, our commission business action items, and calling on John Tsutakawa.
Okay, can you hear me?
We can hear you, John.
Okay, great. Good morning, President Khan, commissioners. I'm John Tsutakawa. I recently changed positions from the Director of Contracts and went back to Family and Children's as the Program Director of Operations. And for this item, I'd first like to apologize that it's retroactive. It's not a regular item that was handled by the Contracts Office, and it kind of fell through the cracks last year. So the Human Services Agency requests authorization to retroactively enter into an agreement with the California Department of Social Services for the provision of legal services as related to the RFA, or Resource Family Approval Program, for the period of July 1st, 2019 to June 30th, 2021. There's no cost to the program to San Francisco, but CDSS requires a body to authorize the executive director to sign off on behalf of the county. And so that's why it's coming before the commission. And for some background, the Resource Family Approval Program, or the RFA program, was established 6 years ago, and it replaced multiple approval processes. We used to have separate processes for approving foster homes, non-related extended family members, relative homes, and adoptive homes. And they had different standards and timelines. The RFA program created one process, and that way there were the same high standards for safety and permanency. It also made it easier for a relative placement or foster home to move toward adoptions because they already met those standards. And what this agreement is for the CDSS legal division to represent San Francisco and other counties in the RFA appeal process. So whenever there's an application for approval for a placement in a home, the county makes different decisions on it. And if the application is denied, or an approval is rescinded, or if a criminal exemption waiver is denied or rescinded, or other actions, the family can appeal the decision. And these are decisions that have a lot of impact on the lives of children and families. And there's a hearing process to the state hearing division. So CDSS provides guidance and consultation and representation in these matters to San Francisco and the other counties. And part of that is that the CDSS legal division meets monthly with our county RFA program to consult on decisions before they are finalized and before a notice of action is issued. CDSS also works with the county when there is an appeal, and that includes consultation and representation in the hearing process. And this is a long-standing service from CDSS. and it existed in the foster home approval process before the RFA program was created. So we've always had this kind of support from the state. I'd be happy to answer any questions, and Sophia Isom, who's the program director over RFA, is also available to answer any questions you may have.
Thank you, John. Are there any questions from the members of the commission?
Mr. President, I'm pleased and a little bit surprised that we received this service without charge to the state. I wish there were more things that fell into that process, and I'm pleased to move approval.
Is there a second?
Second.
All in favor?
Aye.
So moved.
Thank you.
Thank you, John. Moving on to item B, Wai-Min Wang, requesting authorization to enter into a new contract agreement with Subvertical for the provision of OECE Child Care Enrollment Database in the amount of $454,000 with the contingency for the total contract not to exceed $500,115.
Hi. Good morning, commissioners.
Good morning.
Hi. For the, my name is Wai-Min Wang, and I'm the Data Policy and Impact Manager for the Office of Early Care and Education, or OECE. For the last 13 years, city-funded, sorry, can you hear me okay? Yeah. For the last 13 years, city-funded early care and education programs have reported child enrollment, attendance, and assessment data to us using a custom web-based data system called COCO that was developed by First Five. The city's two child care resource and referral agencies also fund ECE programs through a variety of state and city vouchers, but they rely on systems of their own to track very similar kinds of child data. Holding the ECE data in 3 different data systems has made it rather challenging for OECE to answer some of the most basic questions about our city ECE funding, such as how many children we're serving at any given point in time, without investing significant time and resources into merging and reconciling these data from 3 different systems. So in November 2018, OECE issued an RFQ to develop and maintain a new data system that would replace these 3 legacy systems among these 3 agencies, as well as the quality rating and improvement system data system that's used by First Five San Francisco, our city department partner. Consolidating these systems through this contract with Subvertical would enable the city and its partners to unify our early care and education data across agencies and more accurate for more accurate, timely, and efficient reporting and greater transparency and accountability with regard to our city ECE funding. I'm available to answer any questions regarding the proposed contract and services, and Elizabeth Leone, our contract manager, can also respond to questions regarding our procurement and contracting process.
Are there any questions from members of the commission? Is there any public comment? Can I ask for a motion to approve item B, Subvertical LLC, for $500,115?
I so move, James McCray.
Second.
All in favor?
Aye.
So moved.
Thank you, commissioners.
Moving on to item 8 is our request for public comment. Is there any public comment? If there are no comments from the public at this time, our meeting is adjourned.
No.
Oh, wait.
Sorry.
Nope. We want to.
I'll help him. So public comment is number 8, and then we're sending in memory of the former commission president.
Oh, right, down here. Okay, I'm sorry.
That's okay.
Okay, I knew this and just forgot it. So, yeah, I'm going to ask for Commissioner Yamasaki and Executive Director Trent Rohr to make comments about the loss of former Commission President Jane Morrison.
Thank you, President Khan. I'm honored to say a few words about Jane. Jane passed away on the 4th of July at the age of 100. And it really is very appropriate that Independence Day.
Michael, I'm in a Human Services Commission meeting.
I beg your pardon?
Go ahead, George. That was just Commissioner Semmel. Go ahead.
Oh, well, anyway, I just feel it was very appropriate that Jane passed away on Independence Day, because independence and independent thinking and acting were certainly her hallmarks. Jane was married for many years to Jack Morrison, who was one of the best supervisors that the city and county of San Francisco has ever had. Both she and Jack were journalists, and Jack was serving as a member of our commission at the time of his death in 1991. Very appropriately, Mayor Art Agnos appointed Jane to take her late husband's seat on the commission, and she subsequently served several terms and was our president more than once. She had a distinguished career in journalism, particularly with KNBR, but her passion was politics and helping the community, and she excelled at that. And we thank her for her years and years of public service. We also, in view of the fact that she and Jack had no immediate survivors, we'd like to extend our sympathy and thanks to her longtime friend and, in effect, daughter, Gimme Park Lai, and I hope that we will provide Gimme with a copy of our minutes indicating our adjournment in Jane's memory. We, of course, mourn her passing, but are confident that she and Jack are reunited and making things better wherever they are. Thank you.
I'd like, yeah,
Go ahead.
Thanks. George, very well said. And I just want to say a couple things. I believe Jane Morrison was president of the commission when I was hired. And she supported my appointment and submitting names to Mayor Brown. And if she wasn't president, she was probably vice president, and perhaps Commissioner Yamasaki was president. She supported me despite one commissioner asking, who is this child, when I went into my interview. And I think that she saw that I valued what she valued, which was service to those who most need it. And that was always what drove Jane. You know, if we had to make budget cuts, she would not support any cut to anybody, because she would say, you know, everyone is deserving. She really, really cared about the clients that this agency served and the agency itself. It was the Department of Social Services back then. You know, Jane was an amazing person. Her memory, first of all, she knew everyone in San Francisco, but her memory was amazing. And she would tell story after story about the intrigue of neighborhood politics in San Francisco, and was just really fascinating to have this conversations with her. I did see one quote. She actually, I remember her saying this to me, that she was born in 1920, and the year when, and she used to always say, she was born in the year when men finally admitted that they had been wrong and women had the right to vote. And I think that sums up Jane really well. I'm glad she was able to bless San Francisco with 100 years of her life, and long member of the commission, and she will certainly be missed. So George, I know you had the pleasure of working alongside her for a long time, and I did under her for a while, and so she will be missed. And I'm glad that we were able to adjourn this meeting in her memory. It is very appropriate, and very, very well deserved.
Thank you, Trent. If there are no other comments, I ask
May I
for a
say
motion.
may I say something, Mr. Khan?
Sure.
I knew Jane and her husband, and I agree with everything that Trent said. They were a wonderful couple. They gave so much to the city and so much to our community. And he was missed, and she will be missed. Thank you.
Well, I'm sorry I didn't know her. It sounds like she was a remarkable person.
Yes, she was.
Anyway, can I have a motion for adjournment?
So move.
Second.
Second?
It is my honor to join in the vote to end the meeting in her honor. Thank you. Peace.
Thank you.
Nice seeing everybody. See you
Bye.
next month.